Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today is part one of a two-part series on the consequences of restricting abortion. In this first episode, I speak with Suzanne Bell, a Hopkins demographic researcher, about a new report that quantifies the effects of SB 8, Texas's extremely restrictive abortion bill that passed in 2021. Bell's research puts an actual number to the question of how many additional live births resulted after the bill was passed. It also brings empirical data to the conversation about how impactful abortion bills can be. Next up, look for episode 657, where part two of the series explores some of the far-reaching unintended consequences of abortion bans on the entire medical system. Please note that this podcast today contains content about pregnancy and abortion. Let's listen. Suzanne Bell, thank you so much for being on Public Health on Call today.
Thanks. Happy to be here.
So you recently released a report with some colleagues that actually calculated how many more live births there were in the state of Texas following some incredibly strict abortion bans that passed in 2021. So tell us a little bit about this.
Yeah, thanks, Lindsay. So we have seen in other research that abortion bans and restrictions have led to reductions in facility-based abortions and increases in requests for medication abortion pills from online vendors. But at the time, we did not know whether or to what extent abortion bans would influence the number of births occurring. And so our study was the first to look at this question in relation to Texas's 2021 ban on abortion in early pregnancy, known as Senate Bill 8 or SB 8, which was the most severe abortion ban at the time. My colleagues Allison Gemmel and Elizabeth Stewart and I used birth certificate data for all 50 states and Washington, D.C. to examine monthly live birth counts from January 2016 through December 2022. And what we did was weight data from states other than Texas to create a synthetic version of Texas based on the period prior to the policy's implementation. And then we examined what happened in relation to monthly live birth counts in this synthetic version of Texas in comparison to what actually happened in Texas during the exposed period from April 2022 through December 2022. And we observed nearly 9,800 births above expectation in Texas between April and December 2022, which is equivalent to a 3% increase in births during this 9-month period. So these findings really suggest that many pregnant people in Texas were unable to overcome barriers to access abortion services, and instead were forced to continue an unwanted or unsafe pregnancy to term. And these results were specific to Texas only. We did not observe a similar pattern in monthly live births during this period in other states.
So 3% is sounds like a significant number. But as you said before, this was sort of a synthetic way of looking at the data. So tell us a little bit about the limitations of this research.
One of the limitations is, we don't know exactly, what happened among these 9,800 additional births above expectation. Our methods allow us to try to get as close as possible to a sort of causal interpretation of these data. But we obviously didn't randomize Texas and these people to experience this policy environment. So it's still in the realm of relationships, but we think gets quite close to understanding the impact of these policies. But one of the limitations of this work beyond that was the inability to look at who might have been most hurt by this policy change. The impacts of abortion bans and restrictions are not uniformly felt by people in the U.S., given existing differences in abortion rates and the ability to overcome barriers to abortion care. So many people seeking abortion care experience intersecting barriers related to, poverty, structural racism, their migrant status, or their status as a minor that are going to make accessing safe abortion incredibly difficult. And the data that we used for 2022 were provisional birth certificate data that didn't allow us to disaggregate changes in monthly live births by the birthing individual's characteristics. But we do hypothesize that the impact of SB8 fell disproportionately on some disadvantaged demographic groups. And we plan to assess potential differential impacts of this abortion restriction when the data become available. And another limitation I want to highlight is related to the consequences of these live births. We were unable to examine the short and long-term impacts on women and their families who had an unintended birth during this period. But findings from other research out of UCSF's Turnaway study, which I was not involved in, indicate that women denied an abortion are more likely to experience economic hardship, lasting years after the birth, more likely to stay in contact with a violent partner. And they're also more likely to have worse health, and their children have slower development and are more likely to live in poverty. So a lot of really significant impacts, negative impacts on birthing people and their families when they're denied an abortion. And we know that the majority of people who seek abortions live below or close to the poverty line. So many of these birthing people and their families in Texas were likely struggling financially even before the recent birth, though we don't have data on this specifically. And then compounding this problem is the fact that states that banned or restricted abortion access following the Dobbs decision and following SB8 in Texas have not implemented corresponding programs to improve maternal and child health or to support families in need. Yet these states have among the worst indicators of well-being for women and children. So that broader context, we can situate our findings in, but our data do not allow us to look at some of these consequences directly.
Sure. And one thing I want to talk about here a little bit is the timing of when you were getting this data. So you've got, more than or nearly 9,800 extra births in the state. But this was a direct result of the one bill that went into effect in September 2021, which was nearly a year before Dobbs was overturned. So when you're talking about all of the hypotheticals here, this doesn't even take into account the fact that since then, Texas has abolished nearly all abortions. So what might we see next?
Yeah, excellent point, Lindsay. So as you point out, any impacts of Dobbs and subsequent policy changes in Texas or elsewhere would not be reflected in these data, given the timing of these policy changes and obviously pregnancy duration. And so we may expect to see even larger impacts on the number of live births to Texans, given now nearly all abortions in the state are prohibited, and most of the neighboring states that were providing critical points of abortion access following SB8 have since banned abortion as well. And we've seen results from the Society of Family Planning's We Count study suggesting pregnant people are now traveling much more and much further to obtain abortion services post-Dobbs. Thus, it's becoming more difficult for people to overcome barriers to access timely abortion care. But many people are also learning about and utilizing medication abortion pills obtained from online sellers. So self-managed medication abortion will likely become an increasingly large share of abortions occurring in the U.S. as many people learn about this option. And it kind of where those two things balance out, the increased bans and further barriers to care, in conjunction with this online self-managed safe medication abortion option will determine what the impacts ultimately are going to be in this post-Roe world in relation to impacts on live births. But it's always important to recognize that options for terminating a pregnancy outside of a facility in one's home state are not equally accessible to everyone. And there will always be people who can't travel, who do not have access to online information about medication abortion or the funds to purchase medication abortion pills online. And these people will have the greatest consequences and life course changes as a result of these recent abortion bans and restrictions following Dobbs.
So with all of this context, your research came out at the end of June. It was very quickly picked up by quite a bit of media. Tell us a little bit about what that conversation has looked like.
Yeah, I think there was a lot of desire for research findings of this nature. Many people up to the point at which our study was published had speculated and assumed that restricting abortion access would lead to an increase in live births. But people were eager for empirical evidence on this relationship. And given ours was the first study to quantify the association between a recent abortion restriction and births and our rigorous methods that we use to evaluate this, our findings did, as you mentioned, receive a lot of media attention. And this coverage I felt was mostly pretty neutral in its presentation of the study results, and discussion of the implications of these additional births largely focus on what we know about the consequences for women, families, and children of pregnant people denied an abortion that I alluded to earlier. I do, hope to see more coverage highlighting the fact that Texas and other states that have since banned or restricted abortion access following the Dobbs decision have not implemented corresponding programs to improve maternal and child health or to support families in need, of which many likely are, given that many people experiencing unintended births are already living in poverty. And these realities make clear, I think, that efforts to restrict abortion have always been about controlling pregnant people's bodies and not about caring for children or families. And I think while that's a little removed from the specific empirical evidence of our study, I appreciate when the media brought out those elements around, reproductive autonomy and choice and the influence that these policies have had on the actual lives of these birthing people and their family.
So the value of empirical evidence in this conversation, you mentioned the Turnaway study before, which has given us just a wealth of knowledge around what the impacts of these kinds of policies are. Given all of that, what's next? What are you going to look at next?
Yeah, so we're eager to continue this work. As I mentioned earlier, my colleagues Allison Gemmel, Elizabeth Stewart, and I intend to explore the potential differential impacts of SB8 once those disaggregated 2022 birth data become available. And I think that's really important to think about and understand which populations might be most hurt by these restrictions on reproductive autonomy, and that might be in most need of additional support following an unintended live birth. And we're also working on exploring changes in infant health in Texas following SB8. So we have those same birth certificate data that give us information about those pregnancy outcomes, preterm birth, low birth weight, stillbirth. There's already been some coverage just looking descriptively at what's happening in Texas and seeing an increase. And so we hope to bring some rigorous methodological analyses similar to what we did with the live birth analysis to an examination of the impact of these policies on infant health. And then eventually, when data become available, we do intend to examine the impact of Dobbs and the associated state level abortion restrictions that passed subsequent to that on fertility and maternal health outcomes like severe maternal morbidity, as well as infant health outcomes, again, to look at broadly what is happening in the U.S. post-Roe in relation to these outcomes.
Yeah, I do want to ask, why Texas? Why has all of your data so far been about Texas?
So far, it's all about timing and data availability. So Texas was the first state to pass an abortion restriction of this nature that was this severe, and that happened in September 2021. And so data for 2022 just became available, a handful of months ago in the spring, which allowed us to get our first opportunity at examining the potential live birth impacts of this policy in this context. And now with Dobbs, that, as you mentioned, passed nearly a year later, we're just now having those births occurring in 2023 that were exposed to this new post-Roe policy environment. And those data for 2023, since we're still in the mix of it, are not yet available and won't be until next year. And so we're just in that waiting game and trying to maximize what we can do and look at in relation to abortion restrictions in Texas, given the timing of when that occurred, to foreshadow perhaps what we might expect in the context of Dobbs as we wait for those data to become available.
Yeah. Would you expect Texas to be sort of a bellwether for some of these other states?
I think Texas is an interesting context in which to be looking at this because it is unique in a lot of ways. It's a huge state. It has a lot of births. And relative to other states that have since banned abortion following Dobbs, but also was kind of an abortion hostile context even prior to that, Texas had relatively decent access. I wouldn't say they had good abortion access, but there were a number of abortion providers as opposed to some states where there might be one in the entire state. And so there was a higher abortion rate in Texas than other states that have since banned abortion. And so the kind of factoring in just the population size and the extent of abortion that was happening prior to these restrictions in Texas, you're going to see more potential change or impact of this abortion ban on live births. In a state like, Missouri, there were just fewer abortions happening even pre-Dobbs. And so the total impact of an abortion ban in that context might be less substantial than, for instance, the 9,800 additional births above expectation that we observed in Texas. So I would not expect, for the 15 states that have currently banned abortion, including Texas, that each of those are going to have 9,800 additional births over a 9-month period. I think it's going to be much smaller in relation to the potential fertility relationship of these abortion bans in other abortion hostile states that have passed those restrictions since Dobbs.
Well, this empirical data is a really, really important part of the conversation, and we appreciate everything that you and your colleagues are doing. And we would love to check in with you again when you know what your next project is.
Of course, we'd be happy to do that. Great chatting with you, Lindsay.
Good talking with you. Thank you.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.